I would definitely say that as part of this whole journey and discovery, you need to think about yourself and what you want. And then you also have to think about the context in which you're operating. And so, knowing your institution and what are the resources that you have at your disposal at your institution is going to be really important, and how you can actually pivot and decide how you engage with technology and technology transfer. So, it's been interesting thinking about sort of career stage and what would I want at different phases, and what would I counsel other individuals who are thinking about this journey. So I'm sort of at the upper middle area of my career, because I've just made full professor. I have administrative responsibilities, and this was my first large multi-million-dollar grant. So I now have moved on to my second large multi-million-dollar grant that I'm working on, and foresee that I will be doing lots of those kinds of projects and program projects and participating on teams and doing a lot of mentoring of junior faculty. And so for me, thinking about where does this fit in terms of my daily work and how do I actually want to work through this, for me, the decision was fairly easy to say, okay, I think I need another partner. This is the way that I need to go. I think if I were earlier in my career, and again, it depends on the type of intervention. For our intervention, it's very clear that we're going to need to partner with healthcare. One of the things that they teach you is that you need to figure out who your audience is and actually who are your clients. And so for us, while patients are the focus of it, I think our clients are actually people who pay for medical services and reducing unnecessary use of different systems and services. So for us, our clients would be health insurers, or could be medical systems, or could be a foundation of some sort. And so for people who are working on interventions that are smaller or have a more narrow scope, if you're junior and you're in a setting where you're at say, a cancer center setting or a healthcare center setting, you may be able to actually partner with the business offices within those systems to actually move that into something that they could do there. At Rutgers, we're a very large matrix style university, and so it's a bit more complex sort of navigating those pieces. But I think that depending on where you're located and what the opportunities are, I've talked to some individuals across the country who have been able to have their offices of offices I keep forgetting what the name of that office is. Yeah, their tech transfer offices have been able to actually spin off an LLC for them, have been able to set that up, have been able to do all of the different things that they needed, and then put them in contact with people in the business school who have actually set these other pieces up. So another model is, depending on where you're at and who you have access to, is actually being able to work with tech transfer offices to do that kind of work. And I think different systems have different levels of expertise and interest in working in these areas. And so depending on both your interest in entrepreneurship and whether or not you see yourself as a tenure track researcher versus someone who's not tenure track but much more sort of in an applied setting, then I could see the pros and cons of doing either one at different career stages. I just happened to be on a tenure track, and so for me, it made more sense to actually partner with somebody else.